Feeling tired, breathless, low on energy, these are the symptoms most people ignore. And one of the most commonest reasons behind them is anemia. Despite being so widespread, anemia is often misunderstood, underdiagnosed, and sometimes wrongly treated. In today's episode of Diagnosis Matters, we are breaking down anemia down to its basic: what it really is, why is it happening, and what actually matters when it comes to diagnosis and management. To help us decode this important topic, we are joined by Dr. Kunal Sehgal, who will simplify the science and clear the confusion around anemia. Let's begin. Hi, sir. Welcome to the show. And to start with our first question, what is anemia and is hemoglobin the only thing that defines it?
When we hear the word anemia, typically we are looking at hemoglobin as a level, is part of your complete blood count report. So, while hemoglobin reflects the degree of anemia, in literal sense, it tells you about the oxygen carrying capacity of your blood. So, if hemoglobin is low, the amount of oxygen reaching the body is low. Now, while hemoglobin is a measure, one thing we should understand is जब हम बोलते हैं कि किसी पेशेंट को फीवर है, फीवर डायग्नोसिस नहीं होता है, फीवर we have to find the cause for the fever. Same way, anemia is a clinical condition. It is not a diagnosis. We need to find the cause. और इसमें we need to know how severe it is. Is it mild? Is it moderate? It is severe. So anemia can be measured by hemoglobin, but we need to understand the reason for anemia, the severity, how fast or slow it has developed. So there are many things which, as a doctor, needs to evaluate for the patient and then take it further.
Very correctly said. So, now why is anemia so common in India despite the awareness which is being done, the treatment options which are available?
A very valid question, and it's always a challenge for us as physicians that the degree of anemia we see in our country is really huge. And I think the cause is multifactorial. One is nutritional deficiency. We know that our diets are not always good due to various reasons. There could be socio-economic factors, the poverty, the lack of a proper healthy diet. We are a very, very carb-rich diet. We are not eating, the right nutrients at all the times. And the second, other reasons other than the typical nutrition deficiency is, say, the number of pregnancies, blood loss, and the number of chronic infections, chronic disorders people have. So, as I said, anemia is just a condition which is multifactorial. And even if we have awareness, there are a lot of myths around anemia. People are ignoring it, and right approach to anemia diagnosis doesn't happen, and then the treatment doesn't happen right, and people are doing over-the-counter treatment. So there is a mixed bag kind of reasons for the amount of anemia we have in our country.
So, what are the early signs of anemia that usually people ignore?
So often, we think of fatigue. Hey, I am very tired these days. I'm having a little hair loss. And as people are growing old, they say this is due to stress, this is due to old age. But often, anemia is hidden behind. And especially if you see while the middle class, upper middle class part of our country may be testing, but the real masses do not have accessibility or do not even do a regular blood test. And even if you do, and I'm saying this amongst even the educated class of people, if I tell a woman that your hemoglobin is 11.5, they say that's okay for me, which is actually anemia. So, and these things start with mild symptoms like fatigue, weakness, and very minor things which are very easy to ignore because you don't know why they are there. And sometimes a symptom like fatigue could be anemia, could be too tiredness, could be lack of exercise and activity in that patient, and various things. So people ignore it. Okay, that's the challenge to come. So doing those regular testing and being aware of what your body is going through is always very useful.
Absolutely. Can someone have anemia and still they are not able to feel it? They can be symptomless?
So this is not uncommon, especially that when you have anemia which is very chronic or slowly developing. Okay, for example, I'll give you two conditions in young Indian women amongst the reproductive age group. The blood loss during periods is extremely, is well known.
Yeah.
Some have more, some have less, and the body goes into a chronic iron deficiency stage. Now, this kind of anemia develops over a small period of time. Similarly, people elderly with chronic disorders like arthritis, chronic infections, the anemia is developing over a long period of time. And the body is amazing. It physiologically adapts. Okay, the heart starts pumping a little more blood. The body is adapting in various things. So the patient doesn't complain of that. Okay, unless the blood loss is acute. If it is acute, then the body feels a sudden change. Till yesterday, I was fine, but since last week, I am having difficulty in climbing stairs. I am breathless, which I was not. And especially, our family members, the senior family members, one out of ignorance and one out of fear that मुझे कुछ होगा, they don't tell. Now, that thing has to go out. The symptoms have to come out, and we need to test. And this is unfortunately very common in Indian women. मुझे कुछ नहीं. That should not be the reason for not testing or not knowing, and ignoring minor symptoms then till they become major is the problem in our country.
Absolutely. So is anemia always due to iron deficiency, or there are any other causes to that?
So I think iron deficiency still remains the commonest cause, but there are numerous other causes. As I said, anemia is multifactorial. While it's like if you have a leaking tap, okay, by just filling water in the tank is not going to solve. The problem is to correct the leaky tap. Okay. So in blood loss, whether it is due to excessive bleeding in menstrual periods, people who have a lot of ulcers or bleeding in the lower intestine due to ulcers there, or piles, for example, it's a leaky tap. These patients will develop an iron deficiency, but the problem needs to be corrected is the actual reason which is causing the blood loss, or patients with chronic arthritis, or simple things, vitamin B12 deficiency. It's extremely common in our country, and unfortunately, we even end up seeing invasive bone marrow procedures for these patients because there are issues due to bad diet, or there could be issues due to malabsorption. So, iron remains the most common cause, but there are many other causes. So, blindly saying this is iron deficiency or assuming that I have iron deficiency is both incorrect.
Absolutely. Now, since you talked about ulcers and the other things, how do you think should a clinician approach anemia, or what should be the first question that they ask the patient to deal with?
Typically, the clinician approaches the patient. As clinicians, when the patient walks into us, we are asking one symptomatology. Okay, what are the symptoms you have? Do you have fatigue? Do you have difficulty while climbing stairs? Do you have, the paleness on the face of the patient, the hand, the nails, the tongue, those kind of things. Vitamin B12 will have a bare tongue, you'll have darkened knuckles. So as a physician, he is evaluating that. He is not only looking at the low hemoglobin, which we know, and it is very important for him to understand how rapidly this has fallen. He may use symptomatology for that. He may use a test like a reticulocyte count to say if this is blood loss related anemia, whether bone marrow starts producing more blood. So there is an increased retic count. So he'll have tools. He can look at the iron and B12 levels. So for him, as him or her as a physician, the doctor is looking not only at the hemoglobin level. It is very important for him or her to understand the reason behind it. I said anemia is just a symptom. So they approach the anemia, what is causing it, and then that's their approach, and then they will do further test or give treatment to the patient.
Absolutely. Now, since you talked about the reports and retics and the other things, how do you think is classifying anemia with as microcytic, normocytic, or a macrocytic clinically? How is this important?
Because this terminology might not be very easy for a layman to understand. We divide the size of the red blood cells, and if it is a small size, we call it micro. If it is a large size, we call it macrocytic. Now, this is very useful in practice because, for example, iron deficiency anemia is commonly microcytic, whereas B12 deficiency anemia is commonly large cell or macrocytic. So, the moment we see the cells are microcytic, the doctor starts looking at iron deficiency and or other causes which lead to microcytic. In conditions where you have chronic infection in the body, the cell size doesn't change. If there is a production failure, the cell size doesn't change. So the approach of the physician is completely different. Okay, if you have macrocytic, the doctor is looking, is there vitamin B12 deficiency? Is there a liver disease? Is there alcoholism? Because all these attribute to macrocytic anemia. So it directs the clinician towards other testing, other symptomatology, and that makes life very easy. So the CBC report is like a very good algorithmic approach where the patient now gets the right direction towards the next step of treatment.
Absolutely, very important. And sir, when do you think that anemia should be treated as a red flag for some underlying disease rather than just diagnosing it?
So in my mindset as a hematopathologist, for me every anemia is a red flag, and because the amount it is ignored, that is a challenge. However, I understand where you are coming from, where it has become a very serious issue. This is very critical that elderly males, because iron deficiency anemia, for example, is very rare, which indicates is there some blood loss happening. Post-menopausal women, because now the periods have stopped. So why is there blood loss? Why is there anemia? Obviously, in a pregnancy, it is very critical to watch that. In children population, and these are the kind of pediatric population. Why is there anemia? Is it nutrition related? Because that affects the growing age of the child. So these are the 3 or 4 places where it becomes a very big red flag, and we need to investigate further a little aggressively and just do not label it as nutritional or iron deficiency. Correct. And look at other causes.
Correct. Now, sir, since you have bifurcated the age group, how do you see anemia appearing differently in children or the pregnant women, adults, and then elderly?
So the symptomatology may remain the same, but like we know, a child may not be able to easily say, fatigue, for example. But if they are not eating or thriving well, if they are not playing as actively, they look paler. That's where the parents are aware that it is something. For an adult, male or female, it's your fatigue, breathlessness, stuff like that. Inability to climb stairs for elderly, because now that inability to climb stairs means either the heart is not pumping well, or the heart is fine, but my oxygen level carrying capacity is low. That's why I'm feeling breathlessness or I'm having palpitation because of that. Right. That's an indirect sign of anemia. So we look at blood pressure, we look at heart, we look at hemoglobin levels, and we combine the things. So this way, different populations may have similar symptoms, but the way they present, and that's why the physician also approaches different, because the activity levels of all age groups are different, and the reasons behind anemia are different. So we need to approach them based not only on the socio-economic factors, the habits of the person, the lifestyles, because today lifestyle impacts a lot. Correct. Okay, so those things come into play.
Right. At what point of time you feel, sir, that anemia could be a medical emergency?
So again, one point here to be understood is this an acute anemia or this is chronic? Now, the reason is somebody who had a hemoglobin of 13, 14 in a male suddenly drops to 7. That patient will present both symptomatically to the physician and it becomes an emergency. Why is it fallen? Yeah. It could be, trauma and accident where the blood loss happens, everybody understands. Correct. But simply in a malaria patient, if you have something like a G6PD crisis because of that enzyme deficiency, the blood will fall. That's an acute emergency. Right. Okay. Now, that is one. Whereas a patient, as I said, is having chronically low hemoglobin 7 or 8 may not get that many symptoms. But yes, if a patient becomes hemodynamically unstable, which means there is an impact on the heart rate is increasing. If there are issues with severe breathlessness, if those are the kind of picture, we know that this patient now requires admission, may require blood transfusion. Because severe anemia presents like what? Patient will feel weak, will have no energy, may not be able to walk, will get easily breathless. And these are all indirect symptoms that there is something happening inside the body. Correct. Because of anemia. Very rightly quoted, sir. Now you've talked about the symptoms and hemoglobin also you've talked about. Is there anything apart from hemoglobin in the blood parameters which can define anemia? So, for a layman, we typically look at a couple of things like the hemoglobin, WBC platelet. But as physicians, as laboratorians, we look at a complete report. So, like we spoke about size, but the parameter which tells us about size is the MCV. Yeah. That is it small or large? A parameter which tells us about variation of size is RDW. We don't need to go into technical terms, but these are parameters which we use. And then we look at the RBC count. Correct. We look at the combination because, for example, there is a inherited condition called thalassemia trait, which also presents with small cells, looks very similar to iron deficiency, but these patients do not require iron. So the difference is in iron deficiency, all these parameters are low, whereas in thalassemia trait, RBC count is high, but the cell size is small. So there are clues, there are indices we put in the report, there are formulas which help us. Now, two other things which I'll stress, because in the day of machines, people just take a printout and say, okay, I know it. Yeah. But there is a pathologist involved there in the background, like us. We see the slide, and the slide gives us different size and shapes of the cell, which gives us clue to which kind of anemia may be. Subtle things like basophilic stippling, and we know this happens in some anemias, but it also happens in lead poisoning. Yeah. Now, nobody tests for lead, but in a right scenario, I might see something in the smear and advise it. And if the clinician feels, we have picked up patients like that. Okay, heavy metal because of over-the-counter supplements, what people are eating, this becomes very critical. And then I also mentioned about retic count because it tells me how the rate of production is happening in the bone marrow or not.
Right.
So a combination of these tests as far as the CBC is concerned, and then obviously there are add-ons. You can do iron studies. People think of serum iron, good test, has a lot of variables, but I would look at ferritin level. So as a patient, if you are looking for a health checkup test, I always advocate serum ferritin levels because serum ferritin levels tells me about my body stores.
Right.
My hemoglobin may be normal, but if my ferritin is low, I already know that I am going to develop iron deficiency. So stuff like that. Then people know vitamin D and vitamin B12 very well these days. People are doing, and they are taking over-the-counter supplements by themselves. So that has to be taken with care under a physician's advice. So those are the kind of broad tests we can do. And once a physician gets some direction, there are many more tests he or she may then advise to the patient.
Right. So we think of a scenario where we have two patients with the same HB value, and they can have different causes of anemia. So would you want to throw in more light for this?
This is extremely common. As simple as one patient has a hemoglobin of 9 due to iron deficiency, the other patient has a hemoglobin of 9 due to B12 deficiency. Okay, both behave symptomatically similar, but the cause is different. One could be blood loss in a lady because of menstruation, which I already mentioned. The other person will say, okay, I am a non-vegetarian eater, I eat veg, non-veg food mix, I have a good diet. Okay, then why am I B12 deficient? And that patient could have malabsorption issues. Okay, things like celiac disease, other malabsorption. There is problems where the vitamin B12 doesn't get absorbed. So even if he or she is taking supplements, tomorrow he may require injectable B12.
Correct.
So again, it's just not one cause, it could be multifactorial. So as I said, hemoglobin is just a level. The cause, the severity, the cause defines how acute or chronic it is and where did it come from. So the approach for us is always that part.
Absolutely. Sir, coming to the lab things, what common pre-analytical or reporting errors you think can mislead the anemia diagnosis?
I think there are a lot of pre-analytical errors which can happen, and there are run-of-the-mill labs today everyone is wanting to open a laboratory today. But there are a lot of things one needs to take care of. Collection of the sample in the right vacuum container. There should be no clots in the sample. The kind of calibration the machines require. Then there are a couple of challenges which do come across in hospitals. Patient was recently transfused, so before and after hemoglobin levels look different. Patient is on an IV line. Okay, if patient is on an IV line, you withdraw the sample from the same line. Is it mixed with the IV line fluid? And patient has multiple punctures already taken. There's a drip going on. In an emergency, you may withdraw from the same drip. Okay, it's not an uncommon error. It's not intentional, but these things happen. So the lab has to be aware in the hospital, for example, to compare previous and current ones. We do delta checks in our lab, and certain variables are there which, as laboratorians, we take a lot of care not to let these things happen. But yes, these do impact. From the patient side, I'll give an example which is not uncommon at all: dehydration. Okay, for example, in dengue, there is severe dehydration, and the patients may come on day one with dehydration with a hemoglobin of 13, 14. And when you hydrate them, the hemoglobin drops to 11.5, 12, which may be actually the true baseline. So this is not a mistake of a lab, neither a mistake of the patient. This is just the body's condition.
Correct.
So these are variables which we have to be aware of. So if I simply see a CBC report, oh, it was 14 today and 12 today, blood has dropped. But if I look at the patient completely and say, okay, this is a dengue patient, day 2, severely dehydrated. Today he is feeling better, fever has gone, hydration is better.
Correct.
Hemoglobin is 12, everything is in place. So it cannot be just show the report to an AI and interpret it. Even in today's age, there is a role where as a team we work to help the patient.
Correct, absolutely. Sir, now we were talking about the iron supplements. Do you think it's safe for everyone to take it, whoever is diagnosed with anemia?
I don't think so, that is correct. As I said, iron deficiency is a common problem, but I wouldn't recommend that iron deficiency is the only cause. So everyone taking iron supplements is not correct. So we would always recommend do this under physician's guidance and not simply do it. The only one thing I'll add is people who have been advised iron supplements, stop it too soon. Okay, so that's something, a message which I would like to give is, if your doctor has advised you iron supplements because you're anemic, the current advice is to continue iron supplements for 6 months after hemoglobin becomes normal. which means if hemoglobin for a female becomes 12, you started at 9, you take supplements, you reach 12, you stop it. No. After it reaches 12, you continue to supplement yourself for at least 6 months, because now you are replenishing your ferritin or iron stores in the body. Otherwise, within a month, you'll go into that vicious cycle again, and you will come to know only after 6 months. So that's not the right approach. And how to have the iron supplements. Okay. See, iron is one thing which should not be combined with milk, calcium tablets, other supplements. It's ideally to be had empty stomach or maybe half an hour, 1 hour before a meal. It's best supplemented with something like vitamin C or like a nimbu pani. Okay. It completely changes how iron is absorbed. Plus, they have their side effects. Some people have complete intolerance to it. Some people, take it and then feel better in a couple of days and they can continue. So, they again, the take-home message is supplements, take it with doctor's advice. How to take it, when to take it, what to combine, not to combine is always under the advice and not by your own self.
Absolutely. That was a great message, sir. Now, coming back to our last question, the biggest myths and misconceptions about anemia that you feel should be corrected today?
I think the biggest myth is I have anemia and it's okay. Okay, I don't think it's okay. I have mild anemia. 11 is normal for me. इतना तो लड़कियों में होता ही है. This is okay. I am 60 and I will accept 11.5 also because I am elderly. I think those are the most common myths we need to get out of our thing. Anemia is there. It's okay. I will manage it myself. Why do I need to go to a physician? It's just low hemoglobin. I'll take iron supplement, like you said, or I'll take vitamin B12 supplements on my own. For how long? When? Those kind of things. Then the second thing is, ignoring symptoms of anemia. Okay, that's the biggest myth. As you said, it's stress. Is it, okay, I know I have periods and I have extra bleeding. It's okay. It will recover by next month. I'll be better. I will eat better diet and not supplement. Even the doctor has said it. Okay, so those kind of common myths, and obviously there are a lot of cultures, religious, traditional biases in our country, and we cannot overcome each and every one of them. But I think breaking myths about scientifically and giving people idea that please do not ignore your health. Okay, hemoglobin needs to be measured, and we always say people asking what are the common tests you should do. I always say basic things like checking your blood pressure on a regular basis. Okay, for even a young person today's with stress environment, a CBC and a blood pressure goes like a very basic minimum. Sugar, lipid profile, we know that. But hemoglobin unfortunately gets measured and still gets ignored.
Absolutely.
Okay? If you've got anemia, treat it. If you've not got anemia, great. Still don't ignore the symptoms, but if you've found it out, approach a physician.
Thank you so much, sir.
Thank you.
If this episode has helped you learn something new, don't forget to like, share, and subscribe because awareness is the first step towards better health. See you in the next episode of Diagnosis Matters because every test tells a story. Until then, stay curious, stay informed.